America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hi, everybody, and welcome to another episode of Main Street Matters, America's small business megaphone. I'm Elaine Parker, the president of the Job Creators Network Foundation. And today we are joined by Dr. Lee Kurisko. Dr. Kurisko is a physician, author, and advocate with almost 40 years of experience. And he grew up in Canada, where he became a doctor. Frustrated by Canada's government-run healthcare, he moved to Minneapolis, and now he warns American residents not to rush to government-run healthcare. Lee, thank you so much for joining us on Main Street Matters today. It's been several years since we talked, so I was very excited to get back together and talk about healthcare and get your thoughts on things.
Well, thanks for having me. I always, this is one of my favorite topics. And I'm actually in Canada right now. We're up at our cabin in Canada, about 60 miles away from where I grew up, Sault Ste. Marie, Ontario. And, when I was younger, it was just kind of the way things were that when you went to the doctor, no money exchanged hands. And I remember thinking it kind of bizarre that if I just go, across the border, people actually have to pay. I remember once having a conversation Many years later, shortly before I went to med school, I had a conversation with a urologist, and he was explaining to me that, Canada's healthcare system is crazy with the government running everything. And I thought this guy was kind of a whack job to think that, that the government shouldn't take care of people. But many years went by. I went to med school. I did a couple residencies. Fairly shortly after I completed my radiology residency, I ended up in a position of, real responsibility as medical director for diagnostic imaging for Thunder Bay region, which is a large area of Canada, about the size of France, although it's not very populated, only about 250,000 people. And I came to see the reality of delivering healthcare under government paradigm. And we had a tremendous shortage of doctors. I was the 8th doctor to join this particular group. To not be underserviced, we needed 13. We ended up having a personnel meltdown. Ended up having three radiologists covering the population when we needed 13. So it was kind of a nightmare. Our wait time for a CT scan was 7 months long. The wait time for an MRI was 13 months long, and a lot of the equipment was sort of old and dilapidated. The only reason our wait time for this MRI was only 13 months long is because I managed to successfully plead the case to the leadership of the hospital that we needed to extend the hours so we could scan more people. And we got our wait time down to 4 months. And we were actually sort of the envy of the province that we had such a short wait time. And so other areas were sending their patients to us. And we actually declined the patients because we said, we've got our hands full. But like in what sort of alternate universe do you turn down paying customers? But the incentives are all misaligned in Canada, where things are budget driven rather than profit driven. And in many people's mind, profit is sort of a bad word, but really the potential for profit is a message of where capital needs to be allocated to provide more resources to meet people's needs. And I ended up medical director, and I was facing just horrible problems. And I happened to read a book that I'd been thinking about reading for many years called Atlas Shrugged by Ayn Rand. Are you familiar with it by any chance?
Oh, yeah.
The basic storyline is that these various, leaders of industry were trying to bring their goods and services to the marketplace, and every which way they turned, the government was in their way, impeding their ability to do what they wanted to do. And as the country and the world became more socialized, living standards declined, and basically, the society just degenerated into anarchy. Well, I actually saw some parallels between my life and the life and the characters of this book, in that these people were trying to deliver a service, just as I was trying to deliver a service of high quality radiology to the people of Thunder Bay region in Canada. And, we really struggled. We didn't have many people. We didn't have a lot of resources, but I did have some ideas on how to improve things. And I came to realize the government is really not in the business of providing healthcare. They're really just in the business of trying to stay within their budget. And they're actually an impediment to healthcare. In a true free market where there's a demand for a service, things will line up so that the needs are met, and without the control of government. For example, this is a really interesting anecdote. We only had 3 people. We're trying to read like all of these X-rays, and this is, a few years before it became routine to read everything on a computer. So we had all these plain film X-rays that we need to go through, and it was tedious. Like, you had to load them up and bring them down, and load them up and bring them down. And there was a device called a roloscope that was fairly common, where you would get a clerk to load the X-rays on a panel that moved, and it would go. You could just push a button, go from case to case to case, and just dictate, and it saved all those extra steps, and you could be much, much more efficient. Well, I sort of begged and pleaded. I said, we're really busy. We're trying to do the work of 13 people with 3 people. We need to have a roloscope. And they said, well, no, we don't have any money in the budget for that. So then they said, well, maybe you could, plead the case for a special dispensation of funds from the Ministry of Health, which was based about 800 miles away. And they're trying to micromanage all these different, resources for different places in the province. Well, anyway, what happened was 3 years later, they got their roloscope. By then, I was long gone and moved to the United States in utter disgust. And, I sort of had some contact with the radiologist still working there. Well, there was still another year or two before they actually came up with some money in the budget to have someone load those films. And meanwhile, I had moved down to the United States, and I was working in a suburban hospital in Minneapolis. And we were getting busier and busier and busier. And me and my partner there, hey, we really need a roloscope. So we spoke to the hospital. We spoke to our radiology group, and we had the roloscope in a month. And the reason we had it in a month, because it made sense to spend those fairly nominal fees of, it's like $20,000 or $30,000 or whatever, to spend that money so you could give better service faster, more efficiently, so that you could do a better job than your competitors, right? And it's just a total contrast between a government system versus a more free market system. Not to say that, the United States system is a paradigm of free market by any means. It's not. And the thing is, it's not just about roloscopes. This is just one tiny example. It's a microcosm of how the government tries to manage everything, right? There's a zillion issues they're trying to manage and trying to figure out where money should go for this and that. And, there's very smart economists that have said for, decades, for a century, that the government is really not capable of running complex systems. The idea that any one individual or group of individuals is actually smarter than the collective intelligence of the whole marketplace is just a folly. The cumulative knowledge of everybody is far greater than any one person or any one group of very smart people. And that's why free markets work so much better than things like socialist or communist systems. And so, I was working as a medical director, and eventually I just realized, I came to understand the message of the book Atlas Shrugged, which is that, socialism, it doesn't work. In fact, it's actually morally wrong because it's predicated upon loss of freedom. And I got fed up and I moved to the United States, and was much happier working in the United States. Not to say that, there aren't problems in the United States, which we should probably talk about shortly, but just to hammer home the issue for wait times in Canada. I looked this up just in the last few weeks. There's the Fraser Institute based in British Columbia, and I think it's every year or two, they do a survey of wait times in Canada for medical care. The average wait time right now for medical care for specialty medical care is 30 weeks. Roughly 15 weeks wait time to get your consultation with, say, a surgeon, and then 15 weeks to get your surgery. Now, that varies widely from province to province. For example, in Prince Edward Island, the wait time for orthopedic surgery is 77.4 weeks.
Wow.
Let's see, in Alberta, it's 67 weeks. So it's just crazy. And the trend has been over time that these waits get longer and longer and longer. Now, the other big issue from the perspective of an average person in Canada is that 1 in 6 people have no access to primary care. And to get specialty care, you need a referral from a primary care physician. So 1/6 of the Canadian population has no access to primary care. They have a little card that says that they have it coverage, but actually can't actually use it. And when I was in Thunder Bay,
When you say no access to primary care, that's just like going in for your annual physical, going into because you have the flu and you need some
right,
Tamiflu, or you've got a
right,
cold and you haven't been
right,
feeling good. That's your
yeah,
first line of medical defense, who says,
hmm,
"Hey, you might let's look further into this, and here's your referral." Something that
hmm,
all of us here in the States pretty readily have access
hmm,
to our primary
hmm,
care doctors in a reasonable amount of time. I mean, at worst, I think I've probably waited, a week or two to
hmm,
get in to see
hmm,
my primary care. But,
yeah,
so in Canada, people have a card from the government
hmm,
that says, we'll pay for it. But they
hmm,
can't get an appointment to see their doctor.
right. And the key thing is to access specialty care in Canada, you need a referral from a primary care doctor. Now, when I was in Thunder Bay, I believe it was about 40% of the population had no access to primary care. There just weren't enough primary care doctors. So people would just present to the emergency department, when they have some kind of a crisis. But effectively, they're shut out of the system for the routine management of their diabetes, high blood pressure, chronic lung disease, or whatever. So that's an incredibly dystopian type of scenario, and it has in the over 20 years since I've left the United States, um, the situation has not changed. In fact, it's just gotten worse. And for example, in the community that's near where we're staying right now, uh, I'm not quite apprised of the situation right now, but I know at one time it took an average of 5 years to get in to see a family doctor initially. That's how severe the shortage was.
I've
So
read that the UK the UK is
mhm,
similar with primary care physicians. You cannot get in to see your primary care
mhm,
physician,
yeah,
but that there's been an outgrowth of a free market system outside of that you can pay to go. I don't know if
mhm,
it's like a concierge type plan. I don't really know the business model, but you can pay extra and be
mhm,
seen. And I've met people from the UK over the years who have said, I take my children to a private doctor and, we pay. It's very expensive because, we're fortunate. These people were fortunate enough to be able to pay it. But if you're not fortunate enough in the UK, you can't pay extra. I mean, you just don't get the
mhm.
care. Has there been any outgrowth in Canada of that kind of privatized system?
Well, strictly speaking, based on the Canada Health Act, if something is medically necessary, it must be covered under the provincial health insurance plans. In which case, like it's basically illegal to compete against that in the private sector. So if say you need your gallbladder out, and it's a long wait, you have no option to pay for it privately, short of going to the United States, which is very bizarre and probably not a great thing to do. I think there's uh, only 1 or 2 countries in the world other than Canada that have that sort of system. One is North Korea, and I forget what the other one was, Cuba or something. And if you know that that's
Cuba.
how they're doing it, it's probably not the right way to go. Um, Now, some things that are totally elective, like LASIK eye surgery, cosmetic surgery, those can be delivered under a free market paradigm. And of course, there is no, wait times for those sorts of things and no shortages of services, and the costs tend to be reasonable. Um, but it's one thing to say Canada has a messed up healthcare system, but the United States also has a messed up healthcare system as
Mhm.
well. The commonality being is that most of the money that exchanges hands goes through a third party, and so they're sort of calling the shots, and that's why you need pre-approval from the insurance company to get your MRI or whatever. And so that's sort of the fundamental problem. In the United States, with the third party system, where most things are going through insurance, there's as many as 70 or more bureaucrats basically between the doctor and the patient. And those are people that all, have to draw salaries and whatnot, driving up costs. And then with things not being paid for sort of at point of service, but determined externally, there's really no sort of mechanism by which prices and value line up. And that's why, some simple procedure may be, hundreds of thousands of dollars, whereas in the free market, it might just be a few $1,000s. I remember a few years ago, I've had some big dogs, and I remember one particular dog, he tore the anterior cruciate ligament in his knee, and he was extremely lame for that, and he needed surgery. The I was fortunate. I had pet insurance, and it's really fairly reasonably priced.
Mhm.
Well, the total cost for his surgery was $2,850, which I thought was very, very reasonable. It's actually a very complex surgery, more complex than it is in human beings. So there was a $1,000 deductible, and the insurance plan paid me $1,800. They gave me a check, so I remained as a consumer even when I made a catastrophic claim. And I liked dealing with the veterinary clinic that I was used to dealing with, and they were charging another $50 beyond that, so I had to kick out another $50 to get the surgery done. The dog had a great result. But if you looked at the equivalent surgery in a human being, that I would guess that would be like $60,000-$70,000. The difference being is that when you make a claim in human cases, United States, like you're not functioning as a consumer. And so you have this huge disconnect between prices and what people would realistically be willing to pay. And so the pet insurance was very cheap. I forget what it was I paid per month, but it was very, very cheap. And that was the only claim I ever made in the dog's whole life. Like, we didn't bring him in for routine vaccinations and stuff like that and expect the insurance company is going to do that. Like, there's really no way a third party can make the cost drop on that. So routine checkups and vaccinations, I just paid for that. I only made one catastrophic claim. But whereas it is in, human healthcare in the United States, is like virtually everything is covered. And so you get this massive, massive inflation of costs. So, the root cause in both Canada and the United States is that they're third-party payment systems. Ways that you could probably successfully make a huge difference in the cost effectiveness of healthcare in the United States is basically there's three basic approaches. One, it would be, for most things we pay cash. And you were mentioning that you had positive experience doing that yourself before we started recording. I am aware of numbers where it's been expected that if you got insurance companies out of the runny nose business, you could massively reduce healthcare costs in the United States in the order of $500 billion. And what would happen is the prices would become reasonable and people would pay out of pocket. And if they wanted to have insurance for that sort of thing, they would have the option of having insurance for that sort of thing. So cash pay, direct primary care. The other thing would be catastrophic coverage, right? Really, the insurance just kicks in for catastrophic coverage. And for non-emergent things, you could have a situation like I described with my dog, is that they pay a fixed fee schedule. Actually, in the way it worked with my dog, if I wanted to shop around and get a cheaper price, I would be able to keep the difference, just pocket the difference. So it's truly catastrophic.
That is such a fantastic point. And to be honest, it's what I've always said, is that we can do all of these things to try to make our system more free market. I mean, we have these ideas to create more competition, competition, transparent, price transparency, choice, all of those things that we understand as free marketers help drive down costs. But the one thing that you just filled in for me was, how do we create consumers out of patients? And you just said it with your dog, with your pet insurance. And that's that the check comes to the patient. And then the patient says, well, gosh, I have $1,800 now. Let me go see if there's a vet out there that will do this surgery for a little bit less, and maybe $1,600. Right. And then I get to keep, $200. That is how you create consumers.
Right. And actually, for a number of years, I was involved in a startup business called MediBed, where we had an online portal for buying and selling medical goods and services. And unfortunately, we just recently, closed it up. We were not really successful generating enough revenue. Unfortunately, there's very powerful powers that be that didn't like what we were doing. And without getting into too much detail, but the fellow that I was working with, he had worked with legislators in, I'm going to have to sort of obfuscate the statements a little bit, but he was working in a particular state with legislators on what was called reference-based pricing. The idea would be that if, say, you work for the government, the state government, and you need to have, let's say, a gallbladder surgery done electively. Well, you would go online, hopefully using our portal, and shop. And then there would be like a healthcare blue book standard price. Well, if you chose a provider that could provide it for below that standard price, your insurance would pay you a fixed amount based on healthcare blue book, and you could keep the difference. Otherwise, and if you wanted to go above that, you would chip some money and get it from some different doctor for whatever reason that you wanted. And so it truly incentivized people to shop around. Now, interestingly, the whole concept went through committee with bipartisan unanimous approval. But when it went to the floor for a vote, the powers that be, the insurance companies that provide the insurance to the employees of this particular state, basically they got to everybody, all of the congressmen, and just said, if you ever vote for this again, you're never getting any funding from us ever. And the whole thing just died. And they were actually threatening legal action against us because we had the audacity to say to the legislators, well, let's get a handle on, well, what do you pay for your employees to get a colonoscopy or gallbladder out or whatever? Well, that was completely opaque. The insurance providers were contractually able to disallow the state from even knowing what they paid for these things. And by even asking, they were threatening legal action against us. So the problems run really, really deep in healthcare, and there are vested interests that want to maintain the status quo. I could just imagine, if you wanted to design an insurance product similar to what my dogs had, that would be, let's say, probably a 20th as expensive as standard insurance. The powers that be would not be happy about that. Mm-mm. And the third leg of, a radical improvement in healthcare cost efficiency would be, rather than having these huge bureaucracies like Medicaid, have true charity care, which is sort of a basic principle of healthcare, before, all these third-party payers. And the idea would be that, you could provide care, and the facility or the doctor, whatever, could either claim a tax deduction or a tax write-off, or a tax credit. I mean, that's a very creative, out-of-the-box way of looking at things, but I'm sure the big bureaucratic machinery of Medicaid and other governments programs like that, don't want to disappear. But I can give you an example. Doctors John and Alita Eck from New Jersey. They were, one of them is a family doctor, the other is an internist, and they were seeing indigent patients and basically having difficulty, making ends meet because Medicaid reimbursement was inadequate. So what they did is they opted out of Medicaid and opened up a free clinic in their church basement. And they got volunteers to work in it. They got volunteer doctors to work in it, volunteer nurses. And they functioned on private donations. So there's actually and this was for people, that didn't have insurance, that didn't have money. They could see a doctor basically for free, and they would get, donations of drug samplers and that. And so let me back up. If a patient like that was to be seen in a federally qualified health clinic, the cost at that time was something like $1,300. No, sorry, in the emergency department, it was about $1,300 to be seen in a federally qualified health clinic. It was like $600 or $700. The cost to be seen in this organized Zarapath Health Center, initially out of this church basement, was $13, covered by private donations, which shows you that the potential of, private entities to provide charity care can be very effective, but it's sort of off the table because we just look at healthcare as something that's provided by government.
What about the pharmaceutical costs? I mean, I always hear that drugs in Canada are less expensive and that Americans sometimes go there to buy their drugs because they're less expensive than here. But now we have these free market online pharmacies, like Mark Cuban started Cost Plus Drugs. There's a couple others out there. His model, I think, is super transparent. Basically, I think he charges 10 or 15% above his cost. No middlemen, no PBMs. He's completely buying directly from the pharmaceutical companies, and he's charging enough to obviously make a modest profit and pay his overhead. And so people think, wow, 10 or 15%. I mean, that doesn't seem like an unreasonable profit since we're measuring how much people should make in terms of profit. But it goes around the PBMs and the middlemen, and there's nothing that can be done about it. What are your thoughts on these online pharmacies in regards to that?
I think that's a good idea, and it shows you the power of the free market. One of the problems in the United States is basically they've been subsidizing drug research for the whole world. And then you have cost controls, price controls in Canada. So basically what happens in Canada is there's essentially no new drug development at all because of the price controls. Now, for reasons I don't understand, it's been a while since I've read up on this, but the generics are actually more expensive in Canada. I'm not really sure of the mechanisms on that. And then the pharmacy benefit managers, they are a problem. Marty Macri wrote about that at length in his book, The Price We Pay, which is a really good book looking at healthcare economics. But the involvement of these pharmacy benefit managers are based on perverse incentives where they actually massively drive up the total cost of the drugs. And I must admit, I forget the machinations of that. But it can be that if you worked outside of the pharmacy benefit managers and just directly transacted yourself, that the drugs are actually much cheaper. But that's about the limit of my expertise on that.
What about the I forget the measure, the ratio? It's the health outcomes in the United States when it's measured up against Europe and Canada. That the U.S. spends more per patient, but our outcomes are worse. My understanding is that there's a little bit of finagling on those numbers to make us look worse. Because I can't imagine that people waiting in line for their health care and to get diagnostic testing, diagnostic radiology testing to determine if they have cancer, and then having to wait more time to get treatment when we don't have to, that our health outcomes would be worse.
Yeah, that's actually a really good question. I forget the exact numbers, but Canadians do live longer than Americans. And the knee-jerk response is to say, oh, that proves that the Canadian healthcare system is better. But actually, longevity is, the healthcare system is not as much a factor in longevity as you may expect. If it was just about the healthcare system, Americans wouldn't have the shortest lifespan of developed nations, which they do. There's other factors involved. Like, for example, up until fairly recently, Canadians were more of a homogeneous population of Caucasians than were United States. And different racial groups tend to have different life expectancies, even when you factor in, socioeconomic factors. So that may be a factor why traditionally, Caucasians tend to live longer than Blacks, even when you factor in socioeconomic differences, and then the Asians tend to live in longer than Caucasians. So that may be part of it, probably fairly significant because, Canada for a long time didn't have all that many Black people. They were fairly homogeneously Caucasian, and whereas, 13% of the American population was Black. So that may be part of it. The other thing is I think Canadians probably had some better lifestyle habits. Obesity is not as common in Canada as the United States, although they're working hard to catch up. So the healthcare system is not the sole determinant of longevity. And this is kind of a sort of an interesting segue into another area of interest of mine. If you look at the longest lived population that ever existed, the Okinawans eating their traditional diet, they had more people living to 110 years old than anywhere on Earth, even though they had a fairly small population. And they had a very simple diet of fruits and vegetables and sweet potatoes, and it was all food that they'd grown themselves. They worked in the garden themselves. No processed food at all. Very little in the way of animal products. And these people were unbelievably robustly healthy, and virtually no healthcare system to speak of at all. There were no hospitals, there were no CAT scanners, nothing. And these people were living to be incredibly healthy and long lived. So we put too much stock in the healthcare system to keep us healthy. Really, the main determinant of how long you're going to live and how healthy you're going to be, probably the number one determinant is how you live your life. For up until 2017, I didn't fully grasp the weight of that until I read a book called How Not to Die that goes through the top 10 or 15 causes of death by a doctor named Dr. Michael Greger. And he made the connection between, what we eat and the top causes of death. The number one being, heart disease, which kills about 40% of Americans. Well, it's a totally avoidable disease. If you go back to the early 20th century, if you look at, there was missionary doctors working in Africa, and they noticed that people living in rural Africa eating very, very basic diets of fruits and vegetables and whole grains and like no processed food at all, very little meat. These people had like no heart disease. And the guy that really publicized this more than anybody was Dr. Dennis Burkitt, and he kind of made the connection between dietary fiber and health. And he was a British surgeon, and if he was reliant on taking care of the indigent population in Uganda where he would have lost his surgical skills because these people did not get gallbladder disease, they didn't get diverticular disease, they didn't get appendicitis, they didn't get any of this stuff. And he maintained his skills by working on the European population was there. So there's a really profound connection between diet and the health of people. And certainly, most people don't have a hard time grasping that processed food is a problem. One thing that people don't understand, though, is no excess of animal food intake is actually a problem.
All animals are red meat. So chicken, fish.
Chicken, fish, eggs, butter, dairy. One thing that's a shock to people is that the connection between prostate cancer and dairy actually is stronger than the connection between lung cancer and smoking. If there was back in the World War I, there was a naval blockade around the country of Denmark. And so there was really nothing coming in or out. And they were sort of thinking, well, how are we going to feed the people? So what they did is they put a moratorium on animal husbandry. And basically the people started eating the crops that were going to normally be fed to animals. Well, the death rate dropped, I believe it was 34%. Excuse me. It plummeted 34%. And that's, during wartime when people were living with more stress. It stayed down until the lifting of the naval blockade and people resumed their normal dietary habits. And the disease rates went right back up again. Similar experiences happened in Scandinavian countries and in Britain with wartime shortages. So there's two issues: excess consumption of animal products and also processed food. There's not one shred of doubt in my mind that animal products are a problem in human health. Getting back to heart disease, the number one killer, it's been shown that if you put people on a completely plant-based diet, no processed food, no milk, eggs, butter, dairy, whatever, you can actually reverse heart disease, which was thought to be impossible. There's a study there was a study, they took almost 200 people, followed them for almost 4 years, put them on a really, really rigid whole food plant-based diet. And the event rate, in other words, heart attack, stroke, that type of thing, in the intervention group was 1/100th of what it was in those people given standard dietary advice. Um, so this is a huge problem. And then if you look at Americans, only 11% of the calories that Americans eat come from whole plant foods. These are foods that, have powerful health benefits, almost certainly help prevent cancer, reduce heart disease, and prevent diabetes. So only 11% of the calories that Americans eat are from fruits, vegetables, whole grains, legumes, nuts, and seeds. So when you got 89% of the calories coming in as basically suboptimal for promoting health, is it a big surprise that Americans are not healthy? We're spending $4.9 trillion per year on healthcare in the United States. Probably 80, I think it's either 82 or 83% of that goes to chronic disease. Those are diseases like heart attacks and cancer and diabetes, et cetera. Most of that is probably caused by what we eat. So it's not a big surprise to see that Americans don't live that long, and you can compare them to Canadians. Now, Canadians have somewhat similar dietary habits. They're just not as bad as the United States. So you can't sort of say that the healthcare system is the problem in the United States for the shorter life expectancies. From the point of view of managing disease, let me just circle back. When you look at individual disease states, heart attack and individual types of cancer, Americans do extremely well compared to the rest of the world. I mean, if I had, a heart disease or, some type of cancer, I would much rather be in the US than in Canada. And then when they rate, and the other thing is there's inconsistency with how they measure some of these, health outcomes. Like, for example, infant mortality, the way it's measured varies from around the world. Any baby in the United States that has even a flicker of a pulse is considered a live birth. But in some parts of the world, they have to act like, I think it's in India, they have to be alive for like 12 weeks before they're even considered a live birth. So there's actually inconsistencies on infant mortality. A good thing, I was just working on some information regarding diabetes. Diabetes is a huge problem. Right now, almost 12% of Americans are diabetic, most of that being type 2 diabetes, which you develop usually as an adult, but now kids are getting it. It's about 25 times more common in, the type 1 insulin dependent. It's estimated, according to the Center for Disease Control, by 2050, 1/3 of Americans are going to be diabetic. And of course, diabetes is an incredibly expensive problem. As of 2022, the country was spending $419 billion on diabetes, and that's just going up and up and up. Now, we can argue probably till we're blue in the face about the virtues of a more free market healthcare versus a government healthcare system, and I'm totally on the side of free market reforms. But unless we also address why are Americans so unhealthy, we're still going to be working against ourselves as far as trying to reduce healthcare costs. I'm putting together a talk right now. Now, this is a real shocker that most people don't understand. Most doctors and even endocrinologists don't understand this. And maybe what I'll do is I'll just pose a question to you. There was a study done in 1927 where they took a bunch of male medical students, and one group they put on, it was a diet of like eggs and cream and butter, like super, super high fat foods. The other group, they had them eating things like sugar and cornflakes and syrup and rice, super high carbohydrate foods. And then 3 days into the experiments, they measured their ability to handle a glucose challenge. So what they do is they fast for 8 hours. They give them a standardized bolus of sugar that they drink, and then they measure their blood sugars over the next several hours and check the blood sugar response. I'm just curious to see what you think. Which group do you think had the healthier blood sugar response? Those eating the high fat diet or those eating the super high carb diet?
The high fat diet, because it's more natural food, right?
So you're saying that they would have a more normalized blood sugar response in the high fat group?
Yeah, because it's less processed food.
Well, actually, that's true. But actually, it was the opposite of what you would think. It was actually the people eating the most carbohydrates that were able to handle the glucose challenge. And and the difference was huge. Like just 2 days on a high fat diet, the medical students had abnormal blood sugar responses to a standardized bolus of sugar. In fact, their blood sugar spiked higher than twice the normal spike that you would get. And so and I'm not advocating by any means that people consume things like table sugar and syrup and that kind of thing.
Right. Cornflakes.
But the misconception is that the carbohydrates are causing the problem. The carbohydrates are not the problem when it comes to glucose intolerance. It's actually fat, particularly saturated fat, because what it does is it accumulates within your cells and interferes with the ability of the insulin molecule to interact with the insulin receptor. And then if you can put people on a lower fat, ideally whole food diet that's high in carbohydrates, this is what the Okinawans that were living to be 110 were eating, basically. There was sweet potatoes and, vegetables and fruit and that sort of thing. They have a relatively low amount of saturated fat in their cells, and so their insulin receptors can work well and the blood sugar is handled normally. And it works incredibly well. It just works incredibly well to reduce the amount of dietary fat, particularly saturated fat in a person's diet, that if you put them on like a very high carbohydrate diet, within days their blood sugar will normalize. I used to be pre-diabetic myself, and this was the impetus that got me really interested in the whole thing, is I was reading about the value of a sort of a whole food plant-based diet for preventing disease, and I read that it could actually improve blood sugar control. I was so skeptical, but I said, I'm going to try it. I'll try it for a week and see what happens. Well, then 3 days, my blood sugar was completely normal. So I was eating things like fruits and vegetables and potatoes and sweet potatoes and corn and peas and things like that. And within 3 days, my blood sugar was not only normal, it was at the bottom of the normal range, which is optimal for risk of long-term disease risk prevention. So I was sold on the whole thing, and I've really dug into the whole thing. And so that's what my wife and I, Joyce, have this company now called Kurisko Company, where we promote healthy lifestyle, in particular diet. But so the point being that if people ate a better diet, we could probably massively improve the health of the American public. There's links to heart disease and cancer and autoimmunity. Fatty liver disease, which is becoming an epidemic in this country. 38% of people now have fatty livers, which is just crazy. And it's actually, in and of itself, it's a problem, but it's also a marker for accelerated heart disease and early death.
Right.
Diverticular disease, gallstones, et cetera, et cetera. These things that are bread and butter, day-to-day things that you see in the day-to-day practice of medicine over and over and over again are dietary related. And this is where the healthcare system in the United States is not so great, is they don't tell people that these common problems totally reflect back on our day-to-day habits and primarily what we're eating.
So what I'm going to take away from this, because unfortunately we're out of time. I think I could spend 2 hours, maybe 3 hours with you, because I am really into eating healthy. I am encouraged by my doctor to stay away from processed foods. And I do exercise every week, and so I'm probably above average. I have a friend whose daughter is eating exactly the kind of diet you're describing, plant-based, everything. I mean, nuts, vegetables, fruit, everything, and lives a very healthy diet. And I always think, gosh, what is she missing out on? But clearly she's doing better than the rest of us. Tell our audience where they can go to find out more about healthy living as well, because you're right. The other piece of this, and I've always understood this, is that 70% of it is your diet, right? 70% of this game is your diet.
Yeah, at least. Yeah.
Where can people go to find out more about what you're doing, what you're working on, and if they want to, purchase something from you or whatever on your website, if there's a book they can buy, I would love to help educate more people about this.
Well, we've actually got a free e-guide to get people started on a plant-based diet. So it's just a matter of going to kuriskoandcompany.com. We also have a YouTube channel. If you just put in the search bar, Kurisko & Company, we've got probably over 200 videos up now, and we're constantly working on more. So that's a good place to start. A couple other projects we're working on. I know we're running out of time, but we're developing a corporate wellness program, sort of evidence-based, which we believe the evidence sort of points towards, people need to eat more plant-based. So that's a big project that we're working on. And we're also working on a documentary about cancer right now. Our hope is that we're going to get this out by the end of the calendar year. We've got just a few more people to interview for it. So probably 80% of the filming is done. And it's called Uninformed Consent, the truth about the untold truth about the war on cancer, dealing with various issues that people that have cancer or know somebody that have cancer would probably want to know more about than they do. Things like shortcomings of some of the laboratory tests, the genomic testing, some of the problems with the drugs that are not terribly effective but are very expensive, limitations of screening, which is something that people don't understand, innovative strategies to deal with cancer that are cheap, probably effective, but are not part of the mainstream narrative because there's very little or no money involved. So, like I say, we're hoping to get that out by the end of the calendar year.
Well, when it comes out, Uninformed Consent is the name of the documentary. When it comes out, we'd love to have you back and talk about it again, because I think this is very interesting. It's a piece of the puzzle that I think most Americans don't understand. But I want to thank you so much for coming on the show and taking time to join us and talk to us about the healthcare system as well as healthy lifestyles. And thank you all for tuning in to Main Street Matters, America's small business megaphone. Main Street Matters is part of the Salem Podcast Network, and new episodes debut every Wednesday and Friday. You can subscribe to the show anywhere you get your podcast from, and we'll be back soon with another episode. Bye for now.